This is Charter Local Edition. Brad Pomerance here, coming to you from the National Association of Counties Convention in Long Beach, and we are joined today by Dave Roberts. He is a supervisor in San Diego County. He is currently first vice president of the California State Association of Counties, CSAC, the incoming president. Clearly you're committed to counties and county governance and organizations dedicated to counties. Why?
Well, the work of county government really is critical to providing those services that really matter to our constituents, whether it's public safety, public health, child welfare, and a lot of people don't even know what counties do, but it probably affects them every day of their lives.
You speak the truth. I have learned through my job, which I love very much, that while the local newspaper may cover the mayor, well, yeah, of course, the mayor of San Diego is important, don't get me wrong, but the county really has a much more day in and day out impact on our lives, at least in California. All federal monies come through the county, a lot of state monies come through the county.
Well, you know, our budget just in San Diego, $5.4 billion to take care of 3.3 million constituents. Everything, air quality, water quality, public safety, so really important jobs. I'm partnering with the mayor of San Diego right now to rebuild the film industry.
Nice.
But we're working on so many different projects that really matter to the residents of San Diego.
And I've said this, and I believe it in the depth of my core, if one wants to be in elective office, and one really wants to have a dramatic impact on their neighbors, county government. I mean, because on a daily basis you are working, especially in unincorporated areas where you're essentially their mayor.
Right.
I want to talk to you about public health. And, you know, let's look back, I don't know, 20, 25 years. There was a real panic surrounding HIV and AIDS, whether one was gay or straight. I mean, it was palpable. Today, I don't feel that panic, and while that may be positive, it is a little bit concerning because HIV still is a health crisis. One does not want to contract the virus. Am I seeing this correctly, sir?
Well, I think public health affects all of us. And in San Diego, we have approximately 20,000 cases of HIV/AIDS and one new infection almost every 18 hours. And one of the concerns is why this affects everybody is because of the public health crisis, is that taxpayers are paying for this one way or another. And we recently, working with Chairman Ron Roberts, brought forward an initiative called Getting to Zero. We wanted no new HIV infections in San Diego County, and we thought that was possible with a new awareness campaign, new education campaign, and taking advantage of new drugs that were developed.
And I want to talk about those new drugs, miracles, really. I've known them to be called PrEP and PEP. Explain what PrEP is, explain what PEP is.
So in simplest terms, there are two drugs. One drug could be thought of as a morning after pill. If you are a sexually active person and you have engaged in risky behavior, there is a pill that you can take after risky behavior that will prevent you from contracting HIV. And
is that the PEP or the PrEP?
That's the PrEP.
Got it.
And the other drug you can take is a drug if you're engaging in sexually active behavior, and it will prevent you from, again, contracting it. You can take it over a long period of time.
So if your partner is HIV positive and you are not, can you take PEP and engage in unprotected sex? Or one should still protect themselves?
It's always recommended to have protected sex, and that is the best advice. Our recommendations in our Getting to Zero plan is based on the Centers for Disease Control and Prevention. County's government function is based on the best scientific evidence from the federal government, and that's what we are now rolling out here in the county of San Diego. And one of the things I mentioned, that there are 20,000 cases in San Diego, 6,400 of these folks probably don't know that they have been infected.
That's scary.
And what we're trying to do is to help find these people and make sure that we can get them the treatment they need so we can stop these further infections of other people and get them the treatment that they need.
Because as I understand it, sir, if one can get their viral load down, they'll feel more healthy, but more importantly, they're less likely to transmit the disease in whatever way that it may be transmitted.
Exactly, and that's why it's called getting to zero, because eventually, if we can prevent future infections, this disease can die out.
Let me ask you, if I may, are young gay men, and I want to say gay men in their 20s, let's say, they weren't alive during the panic. Are they understanding how important it is to be smart? I hope it's okay I asked that question, but you know what I'm getting at, sir?
Well, I want to make sure that your viewers understand this affects everybody.
Of course.
Because we had a really good conversation with my colleagues on this topic, because one of the things that there were actually concerns about was testing. Who should be tested? And this is
everyone.
one of the things. And people said, well, only young gay men. And we all said, well, wait a second. What about women? What about pregnant women? What about older people?
Heterosexual men. I've been tested.
Exactly.
You never know.
And again, your question about young gay men, I think everybody needs to make smart decisions.
That's fair.
And I think as time goes on, your question about do they remember what it was like, I think people lose that history. And in San Diego County, we actually have Lambda Archives that tries to document this, both in documents, but also in verbal history. We also have the Diversionary Theater that tries to create plays to showcase some of this so that we continue to show what it was like. And so people don't forget what it was like, and to help people understand this going forward.
You're also looking at the question of mental health. And mental health, boy, it really, when one is impacted, it can have such a dramatic effect not only on the individual, but their families. There's a whole range of mental health questions. We know we're facing a homeless crisis, LA County, San Diego County. And so talk to us about what your county is doing on the mental health front.
You know, in San Diego County, there are just 5 county supervisors. Each of us represent about 650,000 people. And when you join the Board of Supervisors, you kind of pick topics that you're passionate about. One of the areas I picked to focus on was mental health. And it was an area that I'd had a passion in the past about. So when I came to the board, each county is supposed to appoint one supervisor to the Behavioral Health Advisory Board by law. So my colleagues appointed me to that board because of my passion. So I serve in that area, and for the first time this year, our board appropriated over $500 million, $500.6 million in mental health. We also just approved our 10-year roadmap of where we're going on mental health treatment.
Can I ask you though, a lot, I don't want to say a lot, I don't know the numbers, but there is a significant number of homeless that face mental health challenges. What we also know is that law enforcement will encounter those folks and the relationship has been strained at times, but there's an effort to change that conversation. Is that effort being seen in San Diego County?
So I've worked with Supervisor Diane Jacob, our current Vice Chair, to expand a program called Psychiatric Emergency Response Teams, or PERT. And what we do is match up a clinician with one of our deputy sheriffs. So when a 911 call goes in, and if they need a clinician to respond with the deputy sheriff, they can appropriately handle the situation. And what that means is maybe to avert a crisis in that, that medical situation. And so it really helps diffuse the situation overall.
We thank you for joining us. He is Dave Roberts of San Diego County. I'm Brad Pomerance from NACO, Charter Local Edition.